Välkomna hörni till Transplantationsforum. Och för andra året i rad så har vi en dag ska jag säga som faktiskt bara ska handla om detta område. Och det är inte så vanligt har vi upptäckt att man har ett forum där alla inom ett område faktiskt är med. Och transplantationsområdet skulle jag säga som nu då är representant för FOKUS patient som är en mötesplats för life science, hälso- och sjukvård, alla aktörer inom det här området. Att få alla att mötas, lyssna till samma sak och faktiskt få träffas är en stor möjlighet. Och vi tackar speciellt ESOT för den här möjligheten att samarbeta också kring programmet. Should I take it in English?
I was going to translate, but no, I'll let
Very welcome to Stockholm and to the Transplantation Forum for the second year in a row. And actually today is the third day in a row that we have conferences with FOKUS patients. The first day was about person-centered care. The second one yesterday was about cancer. And today it's all about the transplantation area. And we have also connected the program all crossover. So today we will also have seminars about cancer and transplantation. And of course I could ask, if not being transplanted is the ultimate form of having a person-centered care. And we are very happy from FOKUS Patient that we also have this wonderful collaboration with ESOT that support us in programs and speakers today. And I hand over to the new president for ESOT, Gabriel Oniscu.
Tack så mycket. Välkommen till Stockholm från ESOT. For the foreign guests welcome to Stockholm. On behalf of ESOT, we are really pleased to partner with FOKUS patients to deliver this symposium. It's a testament of our commitment to patient-centered care. Those of you who are in Athens clearly saw that commitment in practice. We really want to develop these links, and we feel that this forum is a perfect environment to do so. I mean, there is a breadth of discussions and topics that are relevant for ESOT members, professionals, and otherwise, and also for the patient groups that we want to get your input in. We really encourage conversation and discussion because it's important to shape how we drive the future of transplant together. So, without any further ado, back to the topics. Let's get going.
Indeed. Thank you so much. And we will start today. We have this idea from FOKUS Patient that it's really important to bring a European perspective to Sweden and also a Swedish perspective to Europe. And that's why we're so delighted to have the Swedish representation for the European Commission and its director, Annika Wäppling, Korzinek, maybe, yeah, to come and to share about the health in Europe. Or I leave the floor to you. Very welcome.
Thank you very much for the invitation, Penilla, and for the introduction. Yes, I will not dive into transplantations. That you will do after me. So I will be more of a helicopter view of the European Health Union on a broader scale, maybe also tying the knots between the 3 days. Some of you might have been here the whole 3 days, some are only here for 1 day. But yes, so thank you very much for giving me the chance to speak on the work that the European Commission and the European Union is doing towards the European Health Union. A question that remains as important in post-COVID pandemic world as it was during the peak of the pandemics. Because actually over the last few years, we have been constantly reminded of the fragility of our healthcare systems, how war, pandemics, or other disasters risk undermining the healthcare that we actually take for granted. But in these times of need, healthcare professionals have always showed incredible capacity for teamwork, for working across borders, across medical fields. However, this solidarity and this teamwork and cooperation has often been hampered by, or at least partly by, for example, as we saw during the COVID, hoarding of medical supplies or difficult to access patient data from different member states, and a lack of a coordinated political response across our whole union. But we also saw a lot of, oops, hey, oh. Vi kan lägga tillbaka den. If I would have been a magician, that would have been a nice kind of, that's where the rabbit is jumping out. I'm sorry, I didn't have a rabbit. To harness the solidarity that we actually saw during the pandemic and to enable further healthcare cooperation across the EU, the European Commission announced in October 2020 the European Health Union, or the start of the European Health Union. And with the words of the President of the European Commission, von der Leyen, and this was in the midst of the pandemic, she said, "We cannot wait for the end of the pandemic to repair and to prepare for the future. We have to build the foundation of a stronger European health union in which 27 countries work together to detect, prepare, and respond collectively." And then actually, the baby steps starting to be taken then towards a health union turned out to be very timely. Because then we had the Russian invasion of Ukraine and Europe faced a new looming crisis. And thanks to the groundworks that were already partly laid out, Europe was able to respond more effectively to summon solidarity again. And in July 2022, the Commission was able to sign an agreement that associated Ukraine with the EU for Health program, which is one of the cornerstones within the EU Health Union. And this gave Ukraine access to the full force of European healthcare. And part of the support was the readiness of EU hospitals to receive 10,000 Ukrainian patients just a few days after Russia's invasion. And additionally, since then, the EU has been able to aid in more than 2,000 medical evacuations of Ukrainians to hospitals across the European Union. So whether it's a soldier fighting on the front lines or a child caught in crossfire, the EU has tried to step up to ensure that care is readily accessible to them. But that is not to say that the EU Health Union is an autonomous unit on its own. It is just a framework which works to facilitate the already existing cooperation and the hard work of nurses, doctors, other healthcare professionals across the Union. And of course, compared to the hard work that medical professionals perform every day, whether it's screening for cancer, biopsies, transplants, etc., one would assume that building a political framework should be a rather simple procedure, though it's still work in progress. But let us zoom in a bit and talk about the actual concrete measures taken within the EU Health Union so far and use these 3 days of FOKUS patient event to showcase what effects the Health Union has had and continues to have. So on personalized care, on cancer care, and on transplants. As part of the EU Health Union, the Commission has presented, if we begin at the personalized care discussed here on Monday, the Commission has presented the European Health Data Space. The Health Data Space is a health-specific ecosystem comprised of rules, common standards and practices, and a governance framework. And it aims to empower individuals by giving them better access to and control over their electronic health data. And this allows patients to better access health data no matter where they are in the EU and no matter which medical professional they will meet. It also allows the medical professionals, of course, to provide better, more personalized care and to get a better overview of each specific patient. And again, whether it's a Frenchman going for care in Uppsala or if it's a Greek person seeking care in Strasbourg, this regulation will be a large step in making each encounter between patient and professional smoother and hopefully also decrease administrative burdens. Then we had yesterday's event on cancer and cancer care, and I think you had a clip from EU Commissioner Kyriakidis there, and for those who weren't there, just shortly on the cancer side, because a key pillar of the European Health Union is Europe's Beating Cancer Plan. And their cancer screening is one of the absolute crucial areas where the aim is to ensure that 90% of the eligible population is offered breast, cervical, and colorectal cancer screening, while also several projects are looking into innovative approaches for lung, prostate, and gastric cancer screening across Europe. And key steps have also been taken in increasing the uptake of high standard and quality assured cancer diagnosis and treatments in the form of establishing an EU network linking national comprehensive cancer centers together. And in fact, just recently, at the beginning of October, the Commission announced the first version of the Cancer Image Europe platform, and that it had gone live. And this platform aims to provide a public catalogue of cancer imaging datasets to support doctors, hospitals, research institutes, and innovators in making the best use of innovative data-driven solutions for cancer treatment and care. And finally, in this chronological exercise, we arrive at today and on the effects on transplants. And on this subject, let us begin with the work of ESOT. And thank you very much for organizing this day together. And you have been a key partner in building the EU Health Union. In December 2022, you published a manifesto entitled "Is Organ Transplant Equal for Everyone?", in which Devi May and Luciano Poteno call for policymakers that anyone interested in building a true European health union include equity in organ transplantation in their health agenda. And since the launch of that manifesto, the Commission has helped the funding of the program Bravest, which ESO leads. And that the project has taken important steps to work towards fulfilling the urgent need for equitable organ transplants by, for example, analyzing earlier results and effects of organ transplants and transplant care before, during, and after the onset of the COVID-19 pandemic. And through this analysis, Bravest aims to provide information and knowledge that can help with providing exactly the equitable care within organ transplants that you called for in the manifest. And I think this shows also that the EU Health Union is not built by the European Commission, it's built by driven organizations and individuals. The Commission's work in this context is to provide funding and resources so that passionate professionals and researchers can actually achieve their goals. The European Commission also put forth a proposal for a regulation on substances of human origin in 2022. The proposal supports the continued provision of substances of human origin therapies now and in the future, based on high safety and quality standards and up-to-date technical rules. It extends protective measures to all patients, and furthermore, it follows the step of all previous proposals within the EU Health Union, improving harmonization across member states, facilitating cross-border exchange, and it also creates conditions for safe and effective innovation with this growing, fast-growing sector. And it also aims to improve crisis preparedness and resilience to safeguard the access to these therapies. The proposal contributes to the European Union, to the European Health Union, by pooling technical expertise and achieving economies of scale, which helps creating a single market for healthcare. And that is also partly what the whole Health Union is about, to create a single market also for healthcare. So these examples, I hope you might have seen some common threads. First, the importance of sharing information, the stress on increased cooperation across fields, but also across the EU member states. And thirdly, the absolute centrality of creating more resilience through these proposals and initiatives. And continuing forward, the European Commission will do our utmost to stay the course and do our part in developing the EU Health Union further. And hopefully you will be there with us, giving us guidance and constructive criticism, because we need your input. And the hope is, of course, that we will ensure that EU stands strong against any future medical emergencies, which we hope will never come, but history has proved that they might. And therefore, we hope that the European the whole European Health Union will be an important part in creating this resilience. So thank you very much. I stop there.
Annika, thank you very much, and I'm particularly grateful for recognizing our efforts as ESOT, and we look forward to working together, because we've got some other exciting projects that will help shape the future of care. So now I'm moving to transplantation, and it's my pleasure to introduce the next speaker, Mirela Busic, who is now the head of SoHO, Standard Sections, SoHO, Substance of Human Origin, and the European Directorate for Quality of Medicine in Healthcare and Council of Europe. Mirela, thank you for coming, and look forward to hearing what you have to say about transplantation in Europe. Thank you.
Thank you, Gabriel, for this nice introduction. And thank you, Penilla, for the invitation to present briefly the EDQM activities in this challenging transplantation field. So, as Professor Oniscu mentioned, I recently joined the EDQM organization. I used to work in the Croatian competent authority responsible for the transplantation and transfusion, and then moved in October 2022 in Strasbourg to work for European Directorate for the Quality in Healthcare. The next slide, please. Oh, should I? Okay, yes, the next slide, please. Okay, I can do it by myself. I don't know. Yeah, okay. Okay, maybe we can move like this. Yes, as I mentioned, so just for those of you who are not familiar, just briefly to introduce the Council of Europe, which is founded in 1949. It's an intergovernmental organization, nowadays consisting of our European, of the 46 European member states, and with the population more than 700 millions. So its Directorate for the Quality of Medicine and Healthcare is founded in 1964, primarily and at that time based on the Convention on the elaboration of European Pharmacopoeia, which is later on, which was practically the core of activities of the European of the EDQM. So, but however, as part of the EDQM responsibilities and the mandate is also the field in substances of human origin, which covers blood, organ, tissue, and cells. So, beside those activities that are aimed in European Pharmacopoeia and medicine standards, since recently, especially, there is a huge increase in the number of activities we are doing for the SoHO field. So I will just briefly present the way how this work function and how those activities are done. There are three types of activities which we do at the EDQM related to transplantation fields. So there is a group of activities aimed in standard settings for all these, as I mentioned, organ, tissue, cells, and blood. Then there is a group of activities aimed in technical collaboration, which among member states, sharing good practice and supporting the implementation of standards. And then there are those activities aimed in monitoring implementation of those standards. So depending which in which group, so there are different instruments how we provide those and how we do these activities. In terms of the governments of the transplantation field, there is a European Committee on Organ Transplantation. We call it CDPTO, besides CDPTS, which is aimed for transfusion service. It's an intergovernmental committee, meaning existing of representation of each European country in this committee. This committee proposes and defines the key priority projects in this field, and also then appoint working groups. One is for organ field, and the other is for tissue cells field. So these working groups are under the governance of the CDPTO, and they are responsible for regular revision and updates of those technical guidance in the organs or tissue cells field. So, as I mentioned, these guidance produced by these working groups are revised every 2 to 3 years to ensure that are based on the recent scientific evidence. So for that revision process, we ensure that EDQM Secretariat coordinates all these activities, ensuring that drafting process is performed in due time, and then editing and consultation on the final text. So as a final product, after the text is consolidated and approved by CDPTO committee, those guides are published and distributed in all member states for the clinical, to professionals for the clinical everyday use. Regarding the organ guide, so far we have 8 editions. So the recent edition, 8th edition of the guide, is published in last year, in June last year. And as I mentioned, it collates all updated information in this field, assure the safety and quality of human organs intended for transplantation, is targeted to reach professionals involved in this field, as well coordinators managing the process of donation in hospital, professionals responsible for organ allocation or organization responsible for organ allocation, quality managers, and health authorities or competent authorities in this field. Organ guide we try that is distributed well among countries and professionals working in the field. So we would say that it's really well appreciated by professionals. And currently there is a preparation of the next edition, 9th edition of the organ guide. Organ guides and tissue guides, should I go back? Okay. All these guides can be downloaded for free for our website, EDQM website. You can also order it in paper format. What we are aimed recently to enable that guides are digitalized. They are at the moment, so they are available in the PDF format. However, one of our target is to have a next edition of the guides only in a digital format, but in a more active digital format, so the professionals are able to use it at the bedside in their working places in hospitals. So I hope we will achieve that, and we will also have maybe consultation with final users on their preferences in terms of digital format, how they would like that this digital format is made. Regarding the other instruments in terms of standard settings, EDQM Council of Europe, we also produce the recommendation or resolution in this specific field. I will just mention the most recent recommendation adopted in 2023. On establishing national harmonized organ transplant registries with a view to facilitating international data sharing. And as an appendix to this recommendation, there is a standardized set of data that each national registry should address. So in that way that countries can share and practice, and outcomes of transplantation can be benchmarked. So I think this is in joint effort and currently in the focus as well of the ESOT and all competent authority together with the European Commission. So I think this is one of the key strategic points to be achieved in the next future, in the close future. In terms of technical collaboration, I will just mention the most recent projects we launched just a few weeks ago. These both projects are co-funded by the European Commission. One is aimed in strengthening biovigilance systems across Europe, specifically addressing organs, tissue, and cells. So at the moment, we think that for the blood, hemovigilance is well established. However, there are common challenges that should be explored or addressed in terms of the new BTC regulation, EU regulation, in these biovigilance systems. So this is one of the projects, and maybe the second one, which is also complementing your program today, is a project on strengthening donation after circulatory death. So we aim to produce best practice guidelines by the end of next year for both of these projects. in order to enable sharing good practice, existing good practice or best practice in Europe. And we know that Sweden is really one of the countries that made a huge effort in DCD programs. So we hope to be able to learn and distribute on those lessons learned in Sweden. So I mentioned that the main objective of this project is to support other member state countries in strengthening or developing a donation program after circulatory death. So increasing the availability of organ for transplantation by compiling best practice and providing tools and recommendations for development of DCD programs. As a final expected impact of this project, we hope that the outcomes will contribute in providing more European citizens with the opportunity of donating their organs posthumously, which we consider is the human right. So as well as same as the equity in access to life-saving transplantation treatments. So both of these human rights we hope we will address through this project, and maybe enhance and enable more citizens to be provided with opportunity in their human rights. So just briefly on the project task and the main deliverables. So we have a working group of 16 experts nominated from member states. EDQM is providing secretariat for coordinating the project. So we established the working group, and then we are working on survey that will be validated by working groups, sent to the national competent authority, and then data will be analyzed in order to map existing DCD program and in order to benchmark existing good DCD practice already implemented in member states, and then to be able, based on gap analysis, identify the major challenges and to elaborate recommendations and best practice guidelines for those countries who want to or improve their existing DCD program, or really start from the scratch to implementing new DCD program. So the targeted group and beneficiaries are here listed, but the final beneficiaries is the most important to mention, are professionals working in this field. Especially we will focus on those professionals and policies in end-of-life care policies that are supportive and inclusive for organ donation. And also, as a final beneficiary, all our European citizens, whether in the role of potential donors or in the role of potential organ recipients. And the third set of activities, as I mentioned, is monitoring the implementation of the standards in this field. So one of the tools for monitoring data and volume of these activities in organ donation and transplantation is new transplant letter, recently published 28 volume on the data for the last 22 years. I will not go into details, so you will easily download this new transplant letter to see the situation in all European countries. Data are collected by ONT, Spanish National Transplant Organization. And also this platform is hosted by the Global Observatory on Organ Donation and Transplantation. This data and this transplant letter will be also available, I think, hopefully in few next day in the EDQM website. So you will be able also to download it by EDQM website. So just briefly on the common general total data for Europe, you will see in this new transplant letter that there were almost 40,000 organs transplants performed in Europe in 2022, which represent increase of 6% compared to 2021. Those transplants are performed in more than 1,000 transplantation centers authorized transplantation centers in Europe. The most frequent types of transplantation, as expected, were kidney with more than 60%, then liver and heart transplants. These transplantations were made possible by donors, and more than 2,000 deceased or living donors provided their organs, tissue, and cells for transplantation and benefits of those patients that I mentioned previously. Just always to remind that one single donor can really contribute in saving 8 lives in terms of transplantation of organs and more than 100 lives in terms of transplantation of tissue and cells. What about our waiting list in Europe? So the situation is not so optimistic in spite of those donors who provided transplant organs for transplantation treatment. There are still a huge disparity and organ shortage for all those patients who are on the waiting list, and waiting list is increasing. So here you can see that almost 48,000 new patients were registered in 2022. So it's about 6 new patients every year enrolled in the waiting list. And also in terms of the mortality in the waiting list, so more than 7,000 people died in 2022 while waiting for organ transplantation. So I think these numbers are really something that we should take into account when addressing our policies and efforts in this field. In terms of promoting awareness of public in terms of the importance of decision on organ and tissue cells donation during our lifetime, European Commission, EDQM has established European Donation Day, which all European countries agree to celebrate. It's a second week in October every year. So this year is celebrated 7th of October, but it will be also celebrating during the next Global Summit meeting in Santander. So it's always the opportunity to send a message to public on the importance of our shared responsibility to express our decision or will or wish during our lifetime to our family members. That is the way how we express our solidarity for which all those people who are waiting for organ or tissue transplantation. And lastly, just to mention the new EU regulatory framework that is under the preparation. It's addressing only blood, tissue and cells field at the moment, so the current directives for organs are still in place and not at the moment in focus of European Commission. So the legislative framework for organs, for transplantation for EU countries will remain the same. Maybe the next will be the focus as a next topic. However, there is a new proposal on the regulation for blood, tissue and cells. This proposal is adopted by Parliament in September 2023, and it's waiting adoption by Council foreseen in the first quarter of 2024. So there will be probably 2 or 3 year transitional period for the European countries to adapt, to implement these new requirements. Why I'm mentioning this? Because it's not directly impacting the organ field, but it will really directly impact tissue establishment and tissue and cells field, as this new regulation provides really more, in some parts, more strict rules. And also this regulation reference EDQM guides as technical standards that will be mandatory to be followed up by tissue establishments. So this is also a challenge for us, for EDQM, to ensure that new edition of the TC guide, blood guide, are really scientifically evidenced and updated, providing professionals with the most recent standards in this field. Just to share this information for you. So this is a 5th edition, current edition of the Tissue Cells Guide. Currently, we are working on the 6th edition. As I mentioned, this 6th edition is facing the challenge to be aligned with the new proposal. Although the new proposal of this regulation is not yet adopted. So we are trying to foresee what will be so we are working practically with proposal of regulation and trying to adapt the content of the guide to be ready for these new requirements already addressed within the new 6th edition on the TC guide. So this is all from my side. Thank you very much for your attention, and thank you very much for this great effort you did on behalf of the patient engagement in this field. Thank you.
Thank you so much. And we really appreciate this information that is so crucial to learn more and have the opportunity also to go into the website and take really advantage of new information, and an opportunity also to be in touch with you, and also during the day to be in touch and have some conversations also directly. I think it's most important for us all to have these conversations. Nu så ska vi göra en riktig övning. Vi har försökt promota lite rörelse under de här dagarna. Och jag tror att det finns en hel del som gärna också skulle vilja ha en kopp kaffe. Kan det vara så? Vi flyttar upp kaffepausen i programmet. Det är väl bra? Och då gör vi helt enkelt så att vi ses igen 10:35. Och då är det så att då har vi parallella seminarier. Så vi har hela världen, en lokal precis tvärs över hallen här. Det tar max 1 minut. Mycket praktiskt. Och allt är på svenska under dagen där. När vi har parallella seminarier. Här inne har vi allting på engelska då med de parallella seminarierna. Så enkel regel. Vill man gå och lyssna på ett seminarium på svenska, går man dit. Vill man inte det, utan lyssna på engelska, är man här. Så det är bara att välja nu. Fundera under fikarasten. I will just take this in English because I think everybody needs coffee. So we changed the program and lift the coffee break up to now and meet again at 10:35, and then we have parallel seminars. So everything in English will be in here, and on the other side in the other facility called Hela Världen, the meeting room, will be in Swedish, just across the hall. So let's meet again in 20 minutes. Thank you.